Hi, my name is Cynthia and this is Holt.
We're both current fourth-year medical students at the Medical College of Georgia in Augusta. We hope to take some time today to speak with you about the hypertensive disorders of pregnancy.
You may have heard of the terms gestational hypertension or preeclampsia. These conditions are diagnosed when a pregnant woman develops new high blood pressures, also known as hypertension, after 20 weeks of pregnancy. 20 weeks is about halfway through the pregnancy, or 4 to 5 months. The condition can either happen while pregnant or shortly after delivery.
The exact reason that these conditions occur is unknown. What we do know is that this is the result of a complex interaction between the blood vessels of the mom and the developing pregnancy. It is likely related to the abnormal development of a part of the placenta, which is the structure that provides oxygen and nutrients to the growing baby through the umbilical cord.
These conditions can occur at different levels of severity, with gestational hypertension being just higher blood pressures and preeclampsia being higher blood pressures with evidence of injury to an organ system. Commonly affected systems for mom include the kidneys, the liver, different parts of the blood, the lungs, and even the brain.
The most severe end of the spectrum is called eclampsia and is diagnosed by the presence of a seizure. For the baby, these conditions can lead to growth restrictions, the need for preterm delivery, extended neonatal intensive care unit stays, and worse.
It's important to know that these conditions are very manageable when identified and treated appropriately. Most women who are diagnosed with a hypertensive disorder of pregnancy give birth to healthy babies and don't experience any major complications. We know that pregnancy can be a very scary time with many new and surprising changes. Because of this, we wanted to talk about what might happen during prenatal care to identify and treat these conditions, and what symptoms or signs you can look out for.
There are several identifiable risk factors for the development of these conditions, and your doctor or midwife may speak with you about your individual risk. For women that meet certain criteria, there may be some additional lab work collected, and you may be asked to start on aspirin therapy. In studies of these conditions, daily supplementation with low-dose aspirin, beginning at approximately 12 weeks or 3 months of pregnancy, has been shown to decrease the likelihood of developing these conditions in higher-risk women.
If you're currently expecting, you should know that during your routine prenatal care visits, your doctor or midwife will take your blood pressure and perform routine urine testing to help screen you for these conditions. For this and many other reasons involving the health and safety of your pregnancy, it's important to attend your scheduled prenatal care appointments.
You may be thinking, what can I be looking out for to help? Signs and symptoms of these conditions differ from person to person, but can include rapid weight gain or sudden swelling, changes in vision, pain in your stomach on your right side near the ribs, severe nausea and vomiting, or a headache that might not respond to medications.
Any of these might be signs that you are developing one of these hypertensive conditions, and you should contact your provider or seek care immediately. It's also important to discuss these concerning symptoms with your family or partner, so that those close to you are aware and can help you to get care if your condition worsens.
As we mentioned before, eclampsia is the most severe form of these conditions, and it is diagnosed by the presence of a seizure. If you're unfamiliar with this term, seizures are an episode of a loss of consciousness followed by a stiffening and shaking of the body. This is usually followed by several minutes of confusion and disorientation.
If a pregnant woman has a seizure, it is crucial to seek immediate care at the nearest emergency department. While there are chronic health conditions that can routinely lead to seizures in both pregnant and non-pregnant women, any seizure in pregnancy should be treated as eclampsia and as an emergency until proven otherwise.
Pregnancy can be a scary time, and a diagnosis of a hypertensive disorder of pregnancy, such as preeclampsia, can be intimidating.
Most moms and babies will experience minimal or even no complications. Routinely attend your prenatal care visits, be on the lookout for signs and symptoms in the second half of pregnancy, and seek immediate care if there are any concerning symptoms.